Can we go forward? All right. Good evening and welcome to the Heartbeat Live, your rhythm for a healthy life. And my name is Dr. Oteng.
And my name is Dr. Gifty Oteng. We are so glad that you've joined us tonight for a topic that is surrounded by confusion and misinformation.
Yes. Thank you for joining us for this topic, right? That's right. We are actually talking about cholesterol. And for decades, we have been told a simple story. Avoid eggs, low fat everything, and your heart will be fine. But what if I told you that much of the story is a lie?
Wow. So tonight we are debunking the biggest cholesterol lies. We are going to separate facts from fiction so you can truly understand what you need to do to protect your heart.
Definitely. So you can know what to do to protect your heart. Our pause is basically this. A simple study, maybe a recent poll, I should say, showed that over 60% of people still believe eating eggs significantly raises your blood cholesterol. That's what a lot of people, over 60% of people believe that. And today we are going to tackle that head on. So as you stay with us, we are going to do that in a little bit as we move forward. So we're going to go to our next segment. So that's the pause. The pause is that's what is believed out there, right? But as we move forward, we are going to make sure that is changed. So you're going to go with us as we move forward and check this information, whether it's true or not, right?
You said what, 60%?
About 60% of people, believe that eating eggs will significantly raise your blood cholesterol. But that's exactly what we are debunking. So let's actually move forward.
Right. So let's jump right into it with the first and biggest lie.
All right. So I'm going to show you a slide that shows what the first and biggest lie is. So we're going to be mentioning the lie, and then we tell you what the truth is, so that you will not think that we are making it up. We'll give you both the lie and the truth, but please pay attention to the truth, because the truth is what matters, right? All right. So we are going to see.
Yes. So the first lie, the biggest of them all, right? All cholesterol is bad.
All cholesterol is bad. Hit your nest on you. All right. All cholesterol is bad. That is the lie that is being told. All cholesterol is bad. But the truth is actually not that. The truth is far from that, because your body needs cholesterol to build its own cells, and produce hormones like estrogen, right? As well as testosterone, and even use cholesterol to synthesize vitamin D, which is very essential for our daily lives. And not all cholesterol is harmful, for that matter. There is also HDL, which is the good cholesterol, and of course there is bad cholesterol, which is LDL. And even LDL also has its own subtypes, some more dangerous than others. All right?
So not all cholesterol is bad.
Yeah.
Okay, so that's the first lie. It's being debunked,
Yes.
right? So if somebody is telling you that you have high cholesterol, if you go to the doctor's office, just to show that you are well informed, right? And the doctor tells you have high cholesterol, you just have to push a little, because you're like, what kind of cholesterol are we talking about here?
Yeah.
Is it a high cholesterol? Is it the HDL? Or is it the LDL? Or is it a total cholesterol? There are other things in there, here and there. So we are debunking the fact that not all cholesterol is bad.
It's bad. And granted, most officers will only tell you when the bad cholesterol is high. So you can basically agree that when they say your cholesterol is bad, they are potentially talking about the bad cholesterol. But if you want details, you can know. And as we go forward, we can actually also tell you that just having bad cholesterol in itself does not predict your heart health in the future, whether or not you're going to get a heart attack, because there are other things that we can factor
Right.
to know if you are actually at risk for heart disease. All right, so that takes us to lie number 2, right? That's what I think we are on.
Yes. So line number 2, high cholesterol automatically means heart disease. That's a lie.
That's a lie. That's exactly what I was actually hinting
Right.
at.
We're talking about
Yeah.
high cholesterol means you have heart disease. So if you go to the hospital, you do your blood work, and it shows that you have high cholesterol, it doesn't mean that you have heart disease. That's not true.
That's not true.
Okay. So it's not just about your total cholesterol. It's also include high inflammation. If you have inflammation in your system, if you have particle size,
how big your particle sizes are.
In your system, if you have insulin resistance, or if you're diabetic, and other factors like triglycerides and your HDL ratio. So that all come together is what really drive heart disease risk. So just having high cholesterol doesn't mean you have heart disease. All these factors come together. So some people with normal cholesterol still may have heart attacks.
Yeah, definitely.
Right?
Definitely.
Yeah, so it's not just the cholesterol that we have to worry about. We have to worry about other things all coming together to affect your heart and you having heart disease.
Definitely. And actually, there's some years ago a study, I think in Boston, by the Framingham study, as they say, which actually was used to predict somebody's risk of a heart attack. And one of the indicators that they use is your HDL to your LDL cholesterol ratio. So they measure how high your good cholesterols are as against how high your bad cholesterol, your LDL cholesterol is. So if you divide the two, if you have a much smaller ratio, then it means that your heart disease risk is higher. So yes, I don't want to, but if somebody has a total cholesterol of 200 or 300, and yet their LDL to their HDL ratio is high, right? Because the HDL is on the top.
Too.
Yeah, the HDL to LDL ratio is high, or in other words, the portion of their total cholesterol, the HDL is higher, then yes, their LDL or their bad cholesterol may be high, but it doesn't predict any major risk for heart disease. As against somebody whose cholesterol overall may be low, and yet they have no or very little good cholesterol, which is the HDL. So having high cholesterol does not necessarily mean that you're going to have a heart attack or heart disease. The only thing is that if you don't pay attention and your good cholesterol portion is low, then of course the risk of getting heart disease is increased. But if your good cholesterol is high, then having an overall high cholesterol does not mean you have a high risk. That is why treatments are actually individualized. You don't just go with numbers because of how high your cholesterol is. It's how the good and the bad cholesterol relate. The ratio is what we actually talk about. So that takes us to the next risk, which we're just going to then move to our slide number 2. The next lie. The next lie is only older people need to worry about cholesterol. Only older people. And a lot of people are getting old. So it means then that if you are young, you shouldn't. Right? I don't think that's true either. That's a major lie that is also out there. Right? You want to say anything about it?
Yeah, so the truth is high cholesterol can begin in your 20s or even earlier.
Even earlier, right?
Yeah, especially with poor diet and poor lifestyle. So heart attacks are rising in younger population nowadays, particularly in African and diaspora communities. So if your diet is not good, if your lifestyle is not that great, and you are young, and you shouldn't just think that I should worry about cholesterol later on in life. No, you have to worry about cholesterol now.
Exactly.
Because of the kind of diet and the lifestyle that you are you're living. So it's like overall, everybody have to pay attention to their cholesterol.
Definitely, definitely. And in the past, it used to be like that because most people who had heart diseases in the past were people who were older, because, with years of accumulation, it became more clear that as you age and age and age and age, your plaques became more increased, and so with age, your risk for high cholesterol increased naturally. But these days, the food that somebody, the bad food that somebody would have eaten in their 60-year lifetime may be eaten by 20, because of all the bad stuff that we are eating, because of the poor lifestyle choices that we have. You may have accumulated the risk earlier in life. So we cannot just say anymore that because you are older, you have high cholesterol or your risk for heart attack is higher because you are older, because the risk factors have they have multiplied, they have increased so exponentially. That's the word I was looking for. That even in young age, as much as in 20s, even in teenage years, some people already have built serious cholesterol levels, which is not easy. Serious. I'm talking about real tough cholesterol that people have that can lead to heart attacks. And so it is not just a disease of the aged. So it's a lie. Basically, that's what we are trying to disprove, right? It's a lie to say that cholesterol or high cholesterol or heart disease, it's a thing of the old people. I don't know if you have anything else.
No. So the scary thing is like you said, it used not to be like that. But because of the diets that we are all eating, it's now at a younger age. So in a nutshell, we have to all pay attention to that.
We have to all pay attention to that. And it's a tricky thing because it's been ingrained in our brains for a long time that we all believe that's the case. So it's not easy to change it. Young people may not be taking care of themselves, but how much bad food they are eating, we forget about those. And that is where things go bad. So we cannot just say that high cholesterol or heart disease, for that matter, is a thing of the old. It doesn't work like that anymore. That's what I think, at least. That's what we think, right? We agree on that.
Yes.
All right. So let's move on to lie number 4. Lie number 4 is cholesterol comes mainly from fatty foods. That's another big lie. It's a big, big, big lie. I mean, of course, if you see this food that we are showing on the screen,
It has a lot of cholesterol.
It has a lot of cholesterol, but that's not the only thing. So if you say cholesterol comes mainly, that's the key word that makes this a lie, mainly from eating foods, then it becomes a lie, right? So the mainly part is where you don't want to be saying, because it's not really mainly from diet. It is from a diet. We can talk about it as something that comes from diet also, but it's not mainly from diet. So that is where we have to go on with and say.
Okay, so the truth is your liver produces 75% of your cholesterol, and the 25 is from the food that you eat.
So it's only 25%.
Only 25%.
That is from food.
Yeah,
Man.
so dietary cholesterol, like from eggs or shrimp, has minimal impact on blood cholesterol in most people. People are still afraid of eating egg yolks or shrimp because they contain cholesterol. Yes, they do, but how much does it affect the blood cholesterol is what you have to ask yourself.
So what's the medical truth here then? If we are saying that is not true, what's the medical truth? The medical truth is for most people, the cholesterol you eat in food has very small impact on the cholesterol levels in your blood. Your liver is actually your body's main cholesterol factory. So if you want to blame somebody, blame your liver. Come on, man. Yeah, the liver is actually the main cholesterol factory, But that being said, the real culprits that tell your liver to go into overdrive are things like saturated fats, trans fats, and most importantly, excess sugar and refined carbohydrates. Those are the ones that actually cause your liver to even make more cholesterol. So, yes, cholesterol is not mainly from food. It's about 25% of your total cholesterol comes from your diet. And so if you want to blame anybody, you better blame your liver. But then there's more to that. As we go forward, we explain why. I think we even said the explanation by saying that when you're eating those bad foods, sugary foods and the rest, then trans fats and the rest, then you're actually adding on to what the liver is already doing, and then it's going to make it worse. So the main problem is not your body, it's not your food, it's what you make, and then a little comes from. That being said, though, we know that people will have to be careful. We don't want people to say that, oh, my doctor says I should stop eating red meat. So do you mean that? So we shouldn't listen to our doctors? That's not what we're saying. We are saying that if you say your cholesterol in general is coming from diet, that is where it's wrong. So we want you to know that some come from your diet, about 25 to 30%, but that's not the only reason. It's a host of other things that come into play that make your cholesterol higher. So limiting your dietary intake of cholesterol is good, but the most it can do is 25%. So there's other lifestyle changes that we have to go, but I don't want to go ahead of myself. Let's move on to...
But like you're saying, the food that you showed before the slide, is 25% is a quarter. So if you can manage the diet to a point, that is not a bad idea at all.
No.
So 25 is still something that you can still pay attention to, in addition to doing other things. But the idea that, when I eat, everything comes from my diet is what we are disproving.
Yes, that's the lie. That's the true lie that we want to debunk, right?
Right.
All right, so let's go to the next one, the fifth point, the fifth lie.
So the fifth lie is statins. The medication statins are the only way to control your cholesterol.
Oh, that's another big lie. Come on, man. That's not true. That's not the only way to control your cholesterol either, right? And why is that, though? Why is it that it's not statins that the only reason, the only way for controlling your cholesterol? Why is that? Yes.
Yeah, so we know lifestyle changes, okay, including diet, exercise, stress management, weight loss, fiber intake, on and on and on, can really improve our cholesterol numbers and reduce cardiovascular risk without medication in many cases.
Definitely.
So it's not just statins that can control it. All these other things that you can do can also control the cholesterol. Yeah. So don't conclude that, I don't have statins, so there is no way I can control it. You can control it by doing all these other things.
And it is a very important, as a matter of fact, it's an uncomfortable position for us because we deal with medications for our diet, for our money, right? So I would really gladly say that, no, take medication so that I can make more money, because the more medicine you buy...
You sure you can make more money?
Yeah, at least that's the industry we are in, I should say.
Right.
But the truth is that it's not just medications. Medications are just a part of it. As a matter of fact, if you are initially diagnosed as having high cholesterol, or however bad it is, you are usually directed to change your lifestyle, to start eating right, do all those good exercises, and focus on certain aspects of your diet that will actually change certain things, right? Before, if it still doesn't come down enough, you are put on medications after, some liver panel has been done, before you are put on the statins, which is a major group of cholesterol medications, right? So it is not just medication. So there's two extremes of an equation right here. Now, people who just give me the medicine and I'm just going to eat my cheesy pizza. I'm just going to eat my meat, my red meat with all the fatty streaks all the time. I'm just going to not exercise. I'm not going to eat good. I'm not going to watch my stress. I'm not going to do anything about it. I got the medicine. So what else? If I'm taking the medicine, why should I worry about those things? That is one extreme. And then there's the other extreme that just don't want to take medicine at all. So you have to be in a balancing act right here. That's what medicine is. It's an art, and you, the patient, must learn to draw also. All right. And so if you need to take it, you have to, but you can't say that that's it. If you get statins, you are all done.
You're good.
You're good. You don't need to do anything else. That's the lie that we are talking about. And then the opposite is also true. So we make sure that we do what is right at each point in our care.
Yeah. And also when you get your medication, you take your medication. I know some people don't read the leaflets that comes with the medication that we get from the pharmacy, right? So if you read it, it tells you with diet and exercise. So for even the medication to work as well, you have to watch your diet and you have to exercise for the medication to work well. Because if you're taking the medication and your diet is that poor, you don't go anywhere. It brings it down, and through your diet, 25% you just add it on, and you're not managing your stress level, you're not exercising, and your liver keep producing more and more, then you are getting nowhere. So the direction with even the statin is with diet and exercise. Take your medication. But because we want easy way out, we want quick fix, we just want to take our statin and be good. And I remember one patient that I was talking to said, so I mentioned that you cannot just take your statin and eat anything. He said, then what's the use of taking the medication? So in his mind, he's thinking that when he takes his medication, like you said, he's good. He can still eat the fatty meats, the cheese and all that, because they are on statins. And because they are on statins, their heart is being protected. But that's a lie. You should be on statin at the same time, watching your diet and exercising and managing your stress, controlling your sugar, doing it all together so that you can get the full benefit from statin.
Definitely. So you can get the full benefit of your medication. All right. So now we can go to the next, the next lie, right?
Yep.
The sixth lie is low fat diets are best for lowering your cholesterol levels. That is the sixth lie. And the sixth lie is low fat diets are best for you. Remember how you buy milk and then you say buy low fat, buy 1% or non-fat dairy. You say non-fat dairy milk, just 2%, don't buy whole milk, low fat everything. That's the lie, that if you do low fat diets, you are actually better off in terms of lowering your cholesterol. That, again, is an absolute lie.
Really?
Yes. I mean, it may help some, but you cannot rely on that as a means of lowering your cholesterol all the time. So that is where we are coming from. Because as you began to say, studies now show that low carb or Mediterranean diets are often more effective at preventing or at improving actual HDL and lowering your triglyceride levels, than just a mere low-fat diet. So changing your diet for Mediterranean diet is better than, just focusing on low-fat diet. Healthy fats like in avocado, nuts, olive oil, extra virgin olive oil are all essential part of what it takes to lower your cholesterol rather than just blanket low fat, low fat cheese, low fat this, low fat that. That's not always the truth.
It's part of the truth though, right?
I will still not, because I've seen people... So
you go for a whole milk over 1%?
I mean, I wouldn't do a whole milk. Neither will I do 1%.
Okay.
I would rather use almond milk.
Okay.
So I'm completely out of the processed food thing,
Being 1% milk.
Yes. Just take myself out from that. Because if I add something of a Mediterranean source, that's from a nut or a seed, I'm better off than somebody who is eating still from animal products and thinking that because it's low, it's better.
Okay.
That's where we are coming from, at least,
And also, like with the yogurt, we have the whole and the 1% and the 2% and the fat-free. They call it fat-free this, fat-free that. So like sometimes too, I think you pay more attention to the sugars and the processed form of it, because you have this mindset that as long as I do low fat here, low fat there, I'm okay. But we want you to look at your diet wholly. And we are suggesting Mediterranean diet, which has a lot more nuts, a lot more healthy oils, a lot more avocados and stuff like that. Doing that will really increase the good cholesterol, which the ratio favors you because you're taking in more stuff that will up your HDL over just focusing on the low fat and all that. So you have to look at your diet wholly, concentrating much more on the Mediterranean diet.
Definitely. And this slide that we're showing shows exactly what we're talking about. So research actually shows that, Mediterranean diets are actually better than just, or low carb diets are better than just low fat diets. Because the other thing is, if you are on a high carb diet too, no matter how low fat your diet is, you are going to produce more triglycerides from the excess carbohydrates. So if you are on a Mediterranean diet, then you are better off all round getting the healthy fats and oils, and also making sure you don't build any extra triglycerides, which eventually would also harm you and lead to a heart attack if not checked.
Yeah, that's really deep because in our mind, we think that, I'm eating carbohydrates. There is no fat in there, so I'm better off, I'm okay. But if studies have shown that if you eat a lot of carbohydrates, this excess carbohydrates, this excess energy, excess sugar is stored as triglycerides, right? And that will really affect your cholesterol
overall.
Indirectly, because like you think that, I'm not eating the greasy foods, I'm not eating the fatty foods and all that. I'm doing only carbohydrates. But in the nutshell, you are still increasing your cholesterol. Yes. So you don't want to increase your carbohydrates, because don't live in this lie that, I don't eat a lot of fatty foods, so I'm okay. I go with the low fat stuff out there, so I'm okay. But you are upping you're taking a lot of carbohydrates, the sugars and all that. So if you are not paying attention to that, your cholesterol will keep going up and up. And in your mind, you think that you are doing all the right things, right? But overall, you are not, because you are believing the lies out there.
Yes, that's very important to take in as a context, right? Because you can't just, because it's really popular to have low fat diets. Everybody wants to do low fat because people think quick fix, you don't get big, you don't gain weight and all that. But then you're eating a host of starches.
Yeah.
You're eating dumplings, potatoes, rice, white bread, and all those things. You're not doing any better. It would be better if you were doing the low fat along with low carb. Then I say that,
Yes.
But just low fat is not enough. You definitely need to make sure that you hit on Mediterranean, use the right oils that they have, olive oils, seeds, nuts, pistachios, those nice things, that avocados, that will basically replace the energy sources that you usually get from starches. Because as you said, when the starches are over, you're going to raise your triglyceride levels. And without the Mediterranean sources too, your HDL goes down, which is the good cholesterol will go down. You don't want that to happen. That's where beginning we said that, somebody may have high cholesterol, but what if they have very good cholesterol amount? What if they are eating a lot of Mediterranean sources, a lot of nuts and seeds and olive oil and avocados, so and salmon and those nice fish, and their HDL cholesterol is high. So their risk for heart disease goes down, even though overall you may think that their cholesterol is high. So that it's a tricky science there, but I think the bottom line is don't just fall for the okie doke, as they say. Which is the low fat. Make sure that you are doing the right things, which is Mediterranean and of course low carb diets. So unless you have anything to add.
Yeah, and also if not only the low carb, you also have to have this exercise. I think we didn't stress much about the other lifestyle
Oh yeah, we'll go on
options.
it before we close, definitely.
Okay.
But
Okay.
yes,
Yeah. So because if you exercise, you are hitting the cholesterol part,
especially the HDL
the
too. It's
HDL.
gonna go up.
Yes. So if you exercise, then number of HDL that you're going to accumulate over a period of time is going to increase. So not just picking the low fat on the shelf, you also have to move your body. You also have to hit the gym, you have to hit the treadmill, and you also have to increase your activity during the day.
Definitely.
Overall, then you will control your cholesterol level.
Oh, somebody gave us a thumbs up.
Yes.
Come on, man. Thank you so much for the thumbs up. If you are watching and you feel you are getting some good info, don't forget to hit the like button, the thumbs up, the share, the like. And if you haven't subscribed to the channel, consider this as a personal invitation to join us by subscribing and even becoming a member of our channel, which you have the links in the bottom of a YouTube video for those who are watching from YouTube. All right, so let's move on to the next, what do you call it? The next lie, the last lie.
The last one, right?
The last lie that we are going to be talking about. It is huge, but it is interesting. But we don't. The last lie, according to my slide here, is lie number 7. Cholesterol numbers are all that matter. The only thing that matters is the cholesterol number. If you know your number, we are fond of telling people know your numbers. Actually, come on, man. It's good to know your numbers. Good. Yes. But the fact that you know the numbers is not enough. It's a lie to just know your numbers and then sit down and let the numbers play you, because that's not what we want for you. Or what I mean, knowing the numbers in itself is not enough. There's certain things, I think we hinted on this when we started the show, that if your numbers are distributed in some way, your heart disease risk may be higher or lower depending on what kind or where your numbers fall. Whether your HDL is high and then your LDL is low, or your LDL is high and your HDL is high, which still means that your heart disease risk may be less. In other words, we're talking about the ratio. You want to help me with that? With the ratio?
So the truth is, you have to, after knowing the number, I think know your number is not bad.
Yeah.
Yes, it's not bad at all, but you have to put it in context. What does it mean? How does it imply? So if your cholesterol is high and you ask more questions, okay, so what's the number for the HDL? And what's the number for the LDL? And you know the ratio between the HDL and the LDL, then maybe knowing that will help you better than just knowing the number for HDL. So I
the
think
ratio is really the point, right?
The point.
If you divide your HDL over the LDL, so the good divided by the bad, that ratio will predict, as a matter of fact, is an indicator of what your cardiac or your heart disease risk is in the future. There's a formula that they can use actually to calculate your 10-year risk of heart disease, of heart attack. The Framingham study, as I was alluding to earlier. And these are some of the numbers it looks at. So how high is your HDL and how low or how high is your LDL? You can have the whole world of LDL. But if perchance you exercise so much, you eat so much Mediterranean food, olive oil, nuts and seeds, and your HDL is high, then who cares about your LDL being high? That is why she said the context is what matters, right? So just knowing the numbers in itself is not enough. It is what the numbers mean. The ratio, if you forget everything about what we have talked about today, remember what is the ratio. That is where you really don't want to, miss, because that's what is important, right?
Yeah. I think they used to go hard on people with bad cholesterol, the LDL. So they were very aggressive in trying to bring the number down, bring the LDL down, because it's too high. It's too high. That's not safe. So after practicing for some time, because they can find somebody overall who is very athletic, very active, doing all the right things, have a good HDL, but the LDL seems to be too high, you know, and they realize that just having bad LDL shouldn't be a marker for the doctor to put you on medication. You know, they have to consider your risk, overall risk, before they decide to treat the LDL.
Yes.
So like you're saying, if the HDL is high and the ratio between the HDL and the LDL is okay, form within this range, then they wouldn't worry so much about your LDL because the ratio looks good. Okay.
Yep.
And also they will also consider your triglycerides level. You know,
Triglyceride level is also a predictor of your heart health. So how high is your triglyceride levels? And then other inflammatory markers are also looked at. And then also another important thing that has to be looked at is what we call coronary artery calcium score, CAC. How much calcification is in your arteries? Let's bring it down. How much calcium is in your artery walls? You know, the calcium deposit, how much the plaques in your arteries have been calcified. You know, how much calcium is there? All those are predictors of your heart disease risk. So yes, the HDL, the cholesterol number, total cholesterol is okay to know, but there's a little more to that. So if you know it, you got to know what they mean. We are not saying go to school and learn what they mean, but ask the questions. Okay, Doc, you're saying my cholesterol is good, but considering my HDL, which is the good cholesterol, do you think the LDL is okay? And you know, ask certain basic questions. If you don't remember, explain to me what this means. It's my HDL. What can I do about this? And sometimes all you probably have to do is to exercise more so that you can bring your HDL up, so that it will counter the bad LDL, which you're worried about, which the doctor is worried about and saying is high. And the good thing is, as you do the exercise, the LDL will also go down. So you get a benefit of both.
Okay.
So that is exactly what we want to say by saying that the numbers in itself is not enough. But there are other important predictors of heart disease risk, which I've mentioned: the calcium score in your arteries, as well as the triglycerides, and of course the ratio. They are predictors of what the cholesterol mean in your heart, and I think that is a very important place.
And also I think some people naturally, like we said, 75% is produced by your liver, right? So naturally, or maybe genetically, their family, they tend to produce more cholesterol. I think you say that a lot, that they are
familial hypercholesterolemia.
Yes,
it's a big word.
Cholesterolemia. Yes, so if naturally your body tends to produce more cholesterol, you know, that can be something to worry about, like, oh, doctor, how come that this is high? You know, so sometimes the doctors can break it down for you so that you don't live in that fear that I'm producing a lot of cholesterol. What kind of cholesterol? What can you do? Like you're saying that, the total cholesterol is high in my family, but what can I do to balance it out? You can exercise to increase the HDL, which will make your chance or your chance of getting heart attack very low. You know, so there are certain things that they can do in addition to what your family history is telling you and what your genetics, your genes are telling you. So that what can you do differently so that you won't fall into the same line? Because like some family, they have a history of heart attack, and they all say that by 50, most of the men in the family die of heart disease, of heart attack, because naturally they tend to produce higher cholesterol. Because of that, that's not the whole story. What kind of diet are you eating? Are you choosing? You know, what kind of activity are you including in your daily lifestyle? You know, those are the things that you can do differently so that overall look will be better for you than somebody who did not pay attention to the other things.
Definitely. And then the other thing is that it is an approach where you basically not just do one thing. You know, you balance all the activities that are required. But I think at this point, we're going to go to our next segment, which is the heart-to-heart Q&A. Come on, man.
Not too hard.
Heart-to-heart questions and answers. That's where we're going. And at this point, we are actually going to take questions. And I think I have one question from Leroy, our own man. Come on, man, Leroy. So, yes, we're going to just put his question there. And then after that, we have some questions in case nobody else asked any question. We want to make sure that at least there is some questions to be asked or answered, I should say. All right, so Leroy's question, I think you can see it, right?
Mm-hmm.
It's, good evening. How do we feel about oatmeal? Come on, man.
Oatmeal.
Oatmeal. You have any view on that? I do.
Milk. Go
I
ahead.
haven't really. I just recently. It's so funny that he's asking.
Go for it. Yeah.
So recently, I found something on the DD. You know, the breakfast joint called DD in the US. I don't want people to go. I don't want to advertise for them. So you know what I mean by saying DD, right? And I tried it. It was really pretty good, except that it has some sugar in there, which I didn't like. But what they did was they shake some oat milk. In fact, initially I didn't even know it was oat milk. I just found out after the fact. They shake oat milk with coffee and then pour it on ice. So they call it what is it? I want to remember the exact name that you can find on the board there. But it's shaking espresso. That's
espresso.
Shaking. They call it shaking espresso. You know, so they shake something, and then you would think that it is good because when I saw it, the picture, I saw there's not much milk in there at all. That is what attracted me. So less milk, okay. And then I found out it was oat milk. Now that's a good question from Leroy. I haven't done the research, but right off the top of my head, I think that oat milk would be better than regular milk.
Whole milk, okay.
Whole milk, especially whole milk, especially if you are looking to cutting down on the energy levels. Because oat milk is coming from whole grain. You presume that they get the milk from the grain called oats, right? Oatmeal. So oat milk would definitely be better than going for the regular milk. But then I haven't done the research to see if they have some gluten in there, which is another ball game because gluten has its own problems. So I would say for now, I would choose that over regular whole milk or even low-fat milk. At least I know it's coming from some grain. And then in the future, if I find anything as far as gluten is concerned, I can put it on the comment section or I'll tell you in person because I know you. What do you think?
Yeah, I think the gluten is a big thing with oatmeal or oat milk, oatmeal, and all the people that have that problem normally
allergies
stay away from the oat altogether. So, like in place of that, maybe almond milk. I don't know, between almond milk and oat milk, which one will you go for though?
I mean, I know about almond milk, but it also has this whole gluten allergy
Problem
thing that
too.
people talk
Just
about.
like the oat. Yes.
But I would definitely take that over processed, whole milk. At least that is coming from, a grain, and that's where we encourage people to, stay on whole grains. So if I can get a milk, so that's from grain, I think it's better that way than to get animal source.
Right.
From.
So it's like plant-based. We have the
plant-based
almond, and we have the oatmeal.
You are definitely not going to get your cholesterol up with oatmeal.
Right.
If you compare it to animal fat milk.
Yes.
Whole milk, definitely not. So if you are worried about cholesterol, then of course it's either the oat milk or the almond milk for that matter.
Yes.
And they have organic sources, and that you can also be happy about. And I don't know if there's no other questions. So I also asked myself, what are the most likely questions that people who watch later may have, right? So one of the questions that I have here that we want to answer is, what if cholesterol isn't the enemy? What should I really be worried about for heart disease? If anybody asks that, what should I really be worried about if cholesterol isn't the enemy? That's a question that somebody can ask. Well, are you talking about cholesterol for heart disease? Okay, what if cholesterol is not the enemy? What should I be worried about? Okay. And
Yeah, I think we touched it likely with our discussion, right? I think that insulin resistance is a big thing. If you have diabetes, and you are not able to control the levels, that is a huge enemy than just having high numbers in LDL and all that. So, insulin resistance is definitely one thing that you have to pay attention to when it comes to heart disease.
and it comes from inflammation. It starts with inflammation. A lot of people are inflamed. The whole body is inflamed. When we talk about inflammation, people just look at their leg and the pain, the swelling. That's not just inflammation. There is inflammation on the inside where there's no swelling being seen, where your body is constantly on the edge because it's mobilizing to fight certain things that get into your blood, such as toxins from bacteria and virus particles from your belly. Remember, we did this thing about microbiome. Some people have leaky gut because their gut is not balanced with good bacteria. There's so much bad bacteria because of so much sugary and starchy foods that they eat. And because of that, there are holes in their intestines and in their belly. So more toxins are flooding into their blood, and that is the spark of inflammation. So your body gets inflamed, and then there's insulin resistance as a result, and then also how much sugar you're taking. And then there's visceral fat building up around your belly, around everywhere. Those are all things that, even if you don't have high cholesterol right now, you should be worried about, because all those result after this. So your cholesterol may not be up right now, but when the inflammation goes on because of your dietary choices, mainly from processed foods and sugary foods, you will get there even if you don't have it today. As you age, it will come. So basically, that is where I would say for that answer. So lifestyle habits are the bigger culprits. Your choice of foods, as well as even if you are exercising or you are not. Those are the ones that we should worry about. So.
Yeah. Okay, so maybe another person may ask this question, right?
Yeah.
Are statins really necessary?
Are statins really necessary?
Should I stop taking mine?
Oh, come on, man. Is my cholesterol medicine necessary? I've been taking this for years. I just want to get off this medication. Why am I still taking it? I don't even see anything. That's the question that somebody may be asking after they watch us. Especially when we hinted that, statins is not everything, right?
Yeah.
But the answer is statins are helpful in very high-risk patients, especially the ones you cited, the people with familial hypercholesterolemia. Some people, even very young age, they are making extra cholesterol. They are not just making 75%, they are making up to 90%. So any little they eat is also making it even worse. And for such people, you have to take your statins, you have to take your cholesterol medications so that you do not get the risk of heart disease. So yes, in high-risk patients, you need the statins to prevent heart attacks. And also for people who have had a heart attack before, if you had a mild stroke, or you had a stroke before, or you had a heart attack in the past, trust me, you don't want to not take your statin or your cholesterol medications. You have to take it. In fact, for some people, studies have shown that, especially with diabetics, if you have diabetes, you should be taking some, I believe, low-dose statin just to stabilize the endothelium or the lining of your blood vessels. And if you stabilize the lining of your blood vessels, then perhaps no plaque will break off to cause a stroke. So you may be taking the statin even when your cholesterol is not so high, but to prevent a stroke from happening because of your previously existing risk of plaques, whether from diabetes or from a previous stroke or heart attack, right? Yeah. So that is definitely an important thing to bring across. If you are taking your medication, please do.
Don't stop.
Don't stop. Yes, you may not feel any worse or any better by taking it. You take it every day and you feel the same. Yes, you're not supposed to feel anything. The feeling is on the inside. The feeling is on the inside. It's preventing you from having a heart attack or a stroke. And we have a lot of people who watch this channel with stroke questions. One video that we did about stroke treatment, almost every week I get a question or a comment on that video. Yes, if you have had a stroke before, this is for you. Do not stop taking your cholesterol medications, your blood pressure medications, and your blood sugar or glucose or diabetes medications. Those are the ways to prevent another stroke from happening and also to stabilize your blood vessels, the inside. The big word I use, endothelium. To stabilize it such that you won't get a plaque breaking off to cause another stroke or block.
Yeah, so some people will be like, why don't I do more garlic, more, ginger, cinnamon? We have a whole lot of other things that we can take instead of the statin. Maybe somebody's question in a different form, right? Why should I do the statins? Why don't I do, the natural stuff and the things out there food-wise so that I wouldn't worry? So because people complain about side effects with statins a lot. They claim that, it makes me feel weak. It makes me not, I don't feel right when I take medication. But I'll be okay if I do more garlic, more, cumin, and all these supplements out there. What's your take on that too?
I think that is still not something that I would do, because the studies don't prove that they can be clinically significant. Yes, you can get some help with your what do you call it? With your
garlic.
With your garlic, but it doesn't bring it down enough for you not to get a heart attack. So yes, you can lower it by maybe 10 points. But if you are at such a huge height and you bring it down 10, it's nothing. And then the other thing is a lot of these things also interact with the conventional medications that you may be taking, that you may be prescribed. And so you can't just go and take them. For the person who hasn't been diagnosed or who the doctor said, just go and change your diet so that you won't get on medication. Yeah. Those people, if they take it, it makes sense, right? Because they are not already high up there.
At the borderline.
Exactly. So maybe bringing in 5 points or 10 points will make a difference. But if you have been diagnosed as somebody who needs the medication, please take the medicine, because whatever you get from the natural sources may not be enough. And I think there's a question probably that follows that. We have a last question, I think. Yes. So the last question that we think some of you may be having, was that it?
No,
yeah. It's similar. It's what are the natural ways to improve your cholesterol without drugs? So that's, well, you answer that then, because I said the opposite.
What's the natural way?
What are the natural ways?
What are the natural ways without even taking drugs at all? I think we touched exercise is a big one, right? So we said that if you exercise, studies have proved this over and over. A lot of studies out there supports this fact that if you exercise, you increase your good cholesterol without taking drugs. Your HDL will definitely go up. So that's a huge one you can start with. And also managing your stress level. When you're stressed, you produce this cortisol hormones that really affect your cholesterol level one way or the other. So you have to find ways and means to be able to cope with your stress level. If you have to stop everything and take a nap, to take a vacation, to take a walk, to take a stroll, to change jobs, to do something so that you are able to manage your stress level. In so doing, you are not taking any medication, but you're controlling your cholesterol level. And you can also do fibers, food. If you come to diet, we have the apples, we have beans, we have oats, we have the fatty fish, the flax seeds, we have the almonds, we have the avocados, all these foods out there, which is part of a Mediterranean diet, So if you incorporate that in your daily diet, instead of going for, the margarine, the butter, the greasy oils, frying every food as much as possible, you can use the air fryer. You can do things differently. In so doing, you are checking your levels, You don't wait till you get there to worry about it. It's preventative measure. You prevent that situation from happening. Like we are aging, right? So there's certain things that you can't do anymore because age happens to be a risk factor for problems and heart diseases. So what are the things that you can control? You can control your age, but you can control your diet.
Oh, you say you can control your age?
You cannot control.
Come on, man.
I wish I could
I was going
control.
to ask, why haven't you shown me that trick yet? Anyway.
You cannot control your age, but you can control your diet.
Right. The other thing,
Yeah.
I think you mentioned exercise and weight loss, right?
Yes.
Losing weight also helps a lot. Just drastically taking steps to, reduce your intake of starches and oils will help you reduce your weight. That will reduce your cholesterol naturally. And then reducing sugars, I think we also alluded to that, right?
And
Processed carbohydrates, all the starches or the white rice, that's doing a lot of our people a lot of harm. The fufus, the bankus, the yams,
even the plantains,
the yuccas, the red bananas that we fry. Or you can think about all those starchy foods. If you cut them right now, if you cut your starch and sugar sources by 50%, I can promise you within less than 6 months, you will see the evidence. But if you eat the same old white stuff, you're not going to make much of a change. You have to deliberately look at those and cut them back. And then also, don't be afraid, to change your fat sources from this canola and vegetable oils that we use to buy and fry stuff to very healthy stuff like extra virgin oil. Fats from avocados, avocado oil for frying stuff, healthier oil. And
it's very expensive.
Yeah, but you are expensive. Come on, man, you are not cheap.
Yep.
Yeah, you got to see from that perspective. Okay,
And if it's that expensive that you cannot even afford it, you just have to reduce the number of times you fry things.
Exactly.
Right.
Exactly. Well, frying itself is not even the best.
It's not good. Yeah.
Yes.
So you can go with the air fryer, and the things that you really have to fry, you have to fry in good oil.
Good oil, right? And then a lot of us can also use nuts, flax seeds and stuff. They fail you so much. If you eat some nuts and you drink water, they swell up. And because they swell up, you are going to be less hungry all the time. So those are some of the things that you can also do to definitely help support lower cholesterol levels and fight off potential heart disease and inflammation. So now we are actually wrapping up now, right?
Yep.
Okay, so what is the biggest takeaway? The biggest takeaway tonight is this: stop fearing the wrong things. The real threat to your heart isn't the cholesterol in an egg. It's the inflammation, which is caused by sugar, processed foods, and an unhealthy lifestyle, sedentary lifestyle. Focus on eating right and eating real whole foods.
Yeah, that's the rhythm for a healthy life, right? Thank you all so much for joining us on the Heartbeat Live tonight.
Thank you so much. If this discussion cleared up some confusion in your head or in your mind, please hit the like button, share this video with your family, and also be sure to subscribe to the channel. Whether you're on Facebook, YouTube, LinkedIn, wherever you watch us from, follow, click the sub, whatever it is, so that you'll never miss any of our shows. And check out also the links in the description and connect with us on all the other platforms and in other places where we give other forms of information that is not even health related. So for instance, right now we have a show, we have a channel that we call Diaspora Convos, where we talk about social issues and we discuss other issues that are not related to health. So if you go to the links, you can basically subscribe to that channel and follow us there and watch us there too. But last week we talked about some important thing there, which is generating some nice discussion. And we talked just for the people who are watching, we just hint you. We talked about why there may or may not be some enmity between African American blacks and African immigrants in the U.S. and of course in the West, wherever they may be. Right? So check that out. Very interesting conversation. And this week we're also going to talk about diaspora marriage and relationships, how they are all breaking down. What's happening in the diaspora when people move here or when people marry abroad. So all those are other fun things that we talk about on the other channel. So don't forget to check out our other channel and link with us, and let's grow our social fund together. But more importantly, we thank you for being with us on this day's show. We're going to be live once a month on here. The other days we just post recorded videos so that we will enjoy ourselves together. And with that, we say, Beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching.
Thank you.
And God bless.